Joining us this morning is Dr. Chouksey, who is with ACMC, and we're going to talk today about immune deficiency and dysfunction. And I have some other questions too about allergies that have been presented to me, knowing that you were coming in.
Sure.
What is immune system? What does this do?
So immune system is the defense system of your body, if you will. Like the countries have army, navy, and likewise, that's how your immune system is. So it does a variety of things.
Okay.
And there are different parts of it which are controlled by different branches. What we're going to focus on today is what my expertise is on, and that is on immune host defense system.
Okay.
So it prevents you from getting sick from infections. It's not to prevent you from cancer or some joint problem and arthritis, but for staying healthy.
Mm-hmm.
So there's different parts of it, but it's really the police department of the body defense system.
Okay, that sums it up.
Yeah.
Deficiency. How common is that?
It's very common.
Is it?
It is very common, yeah. And this is the problem. As we develop increasing knowledge about different ways bodies work, the education department creates more training programs. So if you talk to a generation back, the doctors won't know about this at all, because in that time in the medical school and in the happening, it was not even discovered.
Mm-hmm.
In the last 50-60 years, it has come up a whole lot, and the field is ever expanding.
Gotcha.
So if you think about it, everybody is worried about do I have lung cancer, or do I have colon cancer, or do I have some kind of cancer.
Mm-hmm.
And if you look at overall incidence of cancers and immune deficiency is not commonly thought of, but combined it is actually more common. 1 in 500 people will have some kind of immune problem.
Mm.
That is very common.
Mm.
And cancer is 1 in a couple of thousand people. So if you put all the immune deficiencies together, it's not uncommon at all. But doctors, the new physicians are more exposed. Older generations don't think about it.
Right.
So it's a well-kept secret. It's not well publicized.
Why is it getting more common?
Yeah, it's a good question, and the reason it's getting common is that we are not built same way, or we don't prevent ourselves same way. So if you think about immune system, the job is to keep the bugs off you.
Mm-hmm.
Okay, bacteria and virus and fungi. Now what has happened over time, we've done a very good phenomenal job of keeping environment very good and clean. So your body don't get to see them too much. And if you don't see them too much, it loses its practice. So in advanced countries, allergies are getting very high up because immune system has two parts. If it doesn't do what it's supposed to do, it has overcapacity. So it funnels into the allergic direction, which would be talking before the show.
Yes.
So allergies are getting up, and part of immune system is devoted toward them, and their drill is not very good with that. But vaccines are good. So if you're up to date on vaccine, you can get a training for the immune system. Mm-hmm. But overall, the shift is towards much more allergic and autoimmune problem, and your defense system is not as much exposed because we've done a good job sanitizing hands, sanitizing this, and so on and so forth.
You mentioned allergies, and that's one of the questions I had presented to me to ask.
Yeah.
You. I've noticed that summertime, springtime, I get the allergies, but I thought that goes away when you get colder weather and all that. All the leaves and all that stuff is gone. But I noticed the other night I couldn't stop sneezing. Why is that?
Also, allergies are twofold. Okay, it's simple to say that you can divide it into different. One is outdoor.
Yes.
And one is indoor.
Mm-hmm.
Now, what you're talking and what people think is outdoors, the trees and grasses and weeds and yard. Okay,
mm-hmm.
So those things do die away after the frost, and they will not come till spring. But that is only outdoor Majority of people in this country on average have 5 to 7 allergies. So if you are allergic to, say, dust, that is very much the part of your house too. Molds in your basements and in your bathrooms and your kitchen, there's rampant of those. Cats, dogs. If you think about it, actually in the winter, they're much more indoor and confined. So you're more exposed, and you don't go out and they don't go out.
Right.
So you're having more exposure to animals and pets. So, and then on top of that, in the winter, you have the heating. And with the heating, it's blowing the air. And when it blows the air, where does the air come from? From furnace to your room outlet, there's a whole piping in there. And the dust is settled in you, so it recirculates. When you have heating going on, animal dander, which is stuck in the wall, and the roof, and the carpet, it is being forced up and out. So very, I would say, very hard really to find people who are just allergic to pollens or grasses or trees and not to indoors. Majority of people, as I said, the studies and research indicate they have combination of both. So in the winter time, it's very, it doesn't go away, it's a myth. What happens is people think, oh, I get worse in the summer because they have indoor and outdoor, and in the spring and summertime you got a double whammy. Indoor stuff plus outdoors, so your body gets pushed over. So that is what's happening. So it's definitely, I have tons of patients. Another facet is, as we advance in age, our blood vessel control is not very good. So when you have cold outside in the winter, and when you come inside the home or go in the car where there is warmth, all of a sudden the nose cannot control instantly. So the blood flow to the nose becomes much more when it is warmer and much less when it is cooler, and in the interface there is a part of adjusting. So people, when they enter the house or the building, coming into the car and walking outside, there's this sudden discrepancy in the temperature, and they cannot control, so they have those things. So winter allergies are not uncommon at all.
So what do you do to fight that? I mean, is there shots or?
Yeah. It depends what you have. The shots are very effective. They've been around for 100 years now. Okay, so giving shot is to help you, making you less allergic to what you are. So they're very, very effective in 85%, 70 to 85% symptoms will be controlled by that.
Now, I have a dog and a cat.
Yeah.
And I certainly wouldn't want to have to get rid of them because they're part of the family.
Right.
Even though I continued to have them and I took the shots, would that help then?
Yeah. Yesterday actually I had 3 patients we are starting on shots. One of them has 6 cats and 3 dogs.
Oh boy.
Okay. And that's true, they are part of the family. The golden standard is that avoid things you can. The less you see something, the less your body fights with it. But if you cannot, and a lot of people will, I have people every day saying, I'll get rid of my spouse but not the animal, or my kid but not the animal. It's a very common dictum you hear all the time. So yeah, there is effective treatment. Cat allergies could be treated very effectively. I always say and taught at years at the case, one cat is like 4 or 5 dogs. The cat is very much allergenic. It may be the smaller, but the cat allergen is very strong.
No kidding.
Very strong. Cat allergen is very, fair to say, keeps me very well in business. Okay? It is very strong allergen.
Wow.
So shots work very good, and the cat, and over time the allergen which is given to diagnose and treat is much more effective than like 15 years back. And the most recent research has come that cat allergy needs to be treated very strongly. And strong injections causes reactions. So, a lot of people get allergy shots, and a lot of people are giving allergy shots who are not properly trained to do allergy shots. Like, a lot of other folks who are not board certified or go to the fellowship. So they do very diluted kind of injections. So if you do, it's very funny. I had a 15 or 16-year-old young, very nice young female yesterday. She, just by doing the testing, collapsed on the couch yesterday afternoon. just by testing, not even injection. And it's very funny. The dad was asking me before that can I give allergy shot at home? And I was telling her before this happened, I said, I don't allow that to happen because I'm giving you what your body is allergic to. So if I give you something you're allergic to, your body is going to fight with it, and then you'll have, then you can have allergic reaction at home. And then he saw this happen with the testing, so it kind of made sense to him, but this happens all the time. So if you do a strong allergy shot, you run a risk, but then the treatment is effective.
So she actually collapsed?
Yeah, she collapsed.
So then what did you do then?
Well, I was there, we checked her, and then so oxygen level was okay, blood pressure was okay, so we were right there. So we were able to control her. Fortunately, I didn't have to do anything significant, but that's why anybody comes to my office for allergy shot, I ask them that don't come in a rush. You come there. If you were to have a reaction to injection, I give it to you. I would much rather have it on our watch as opposed to driving home and getting home.
Right.
So patient come, they're always looking at watch and say, oh, nothing happened. But all you need is one bad reaction anytime, and the shot gets stronger as we give it to them.
Mm-hmm.
So then we, and that's why I'm right next to the emergency room in the hospital.
Mm-hmm.
I have nurses all the time and help all the time. So,
how many times do you have to have a shot? I mean,
the shot regimen, or usually on average, I would say 80%, 90% of my patients will get 2 injections. One is for the outdoor, what was you saying?
Right.
Trees and grasses and weeds. And one is for indoors, moles and cat and dog and dust.
Mm-hmm.
In general, you can divide, because those allergens, if you put together, they bite each other off and they don't stay well. So the injection is not effective for patient. Right. So they get 2 injections. On average, there's a series of about 40 injections to make them gradually stronger. I make you used to cat bit by bit, so you get 40 injections. Once you get 40 injections, then you will get injection once a week for 2 to 3 months. Thereafter, once every other week, and over the course of another 9 to 12 months, you'll be getting 2 injections a month. And usually they get around 5 years duration.
Really?
And they get better, much better, 80% symptom control.
Yeah.
So it's a commitment, it's a long-term commitment. I'm very careful in screening patients, identifying and making sure they understand it and they need it and they want it, because I won't want to give it to you and then you go away for vacation for 4 weeks and don't come back.
Yeah.
Then we have to restart again, because anytime I give you a big shock, you can have a big reaction on your body.
It was funny that we talk about this, the dust thing, because my wife said she was cleaning up the house yesterday. She had the day off, and she said, I couldn't believe, Pat, how much dust was in the bedroom.
Yeah.
She goes, I had no idea. And she goes, it was on the fan, it was all over.
Yeah.
And so that kind of answers the question right there.
Yeah, and dust is one thing, and the news for audience is, I don't want to gross people out, but it is a proven literature that dust mite, that is a pathogen. It's not like dead dust. Dust is one thing.
Mm-hmm.
Dust mite is a bug which lives off our skin scales.
Mm-hmm.
Like snakes, we peel our skins too, but we don't peel in case, so small particles come. And because you sleep in the bed or in the couch,
mm-hmm.
when there's friction, it lands there and they feed off that. So our mattresses, if I took a piece in microscope and show it to you, if they're more than 5-8 years old, half the thickness of the mattress is studded with these bacteria.
Really?
Yep. So when you sleep, pillows, I recommend patients to change pillow every 6 months or so.
No kidding?
No kidding, because you put your head on the pillow.
Yeah.
And then you're breathing all night, and this is where the genesis is.
Where do these mites come from?
They are ubiquitous all over the place. Where there's food, they will come.
Really?
Yeah. I mean, like here, you leave this thing here on the table. Yeah. Don't touch it for a week. Will you drink it next week?
No.
Why?
It's old.
So what? You are old, I am old. That's not the idea. So why? What about it?
Well, a week-old coffee just doesn't do it for me, so I don't.
Yeah. More importantly, it'll start to stink and smell.
Okay.
Because there are bacteria around here, and they will sit on anything stagnant, which is not moving.
Yes.
Like the lake, the ponds, water reservoir, They stay put, they don't move. It's a fertile ground for the pathogens.
No kidding.
Yeah. So anything, nothing moves. Now you're sleeping there. Some people drooling, some people snoring. Your nose is coming out there. There's some condensation in there. It's right on the pillow.
Okay.
So there's moisture and there's skin, and that is the food for dust mite.
No.
So that is where the number one commonest allergy is dust mite. I have yet to find people, very few people in my relatively pretty good experience have not had positive reaction to dust mite.
Huh.
Very common. The number one cause.
Jeez, I'm learning so much today. I can't believe it.
Yeah.
That's amazing to me.
Right. No, it is. It's very common, and it's a big problem. It's a pretty big problem. And it goes from nose to the sinus to the lung to the skin. Okay, so it's good, and we're offering this treatment right here. I have a pretty decent size of clinic of allergy shop, and I've actually expanded the hours into the evening now, so it's more convenient for the people.
What are your hours?
I'm in Monday evenings. I'm here now till 8 o'clock.
Oh.
So because the kids don't have to leave school, you don't have to miss work, and they can come after hours. So it's, I'm setting the structure to be more access.
Is that the only day you're in?
No, I'm here Mondays all day till 8 o'clock, 9 to 8, a long day Monday.
Yeah.
Tuesday I'm there in the morning. I go at 7:30. I'm here till 12:31, and Thursday all day. So
Really?
access is pretty good.
Yeah, I guess. Wow.
It's not like touch and fly or touch and go kind of stuff.
Right.
Yeah.
Good morning. You're on the air.
Yes, Pat, Dave Tobias. How you doing?
Hi, David. Good.
Good. I'd like to ask the doctor. I've been getting allergy shots for probably, I'm going to guess, around 10 years or so, and I was going to ask him if how long can you get them, and do they bother your immune system?
Yeah, David, that's a very good question. As I was just telling Pat, if treatment is good and effective, it's strong enough, we can turn the tide in 5 years. Very few patients, fair to say none of my patients has been on shot for longer than 5-6 years. And symptoms can tell, and people can get better, and then you can stop the treatment. Some patients, after stopping the treatment, and testing actually can show it to you, when I do the testing at the intake, patient have a lot of reactions. 5 years later, the reactions will go away on them. Some people, after discontinuation of the treatment, can gain allergies back after a duration of 2, 5, 10, 15 years. And that is difficult to predict. But 10 years is a fairly long time. If you're taking this long, it's worthwhile for you to be reevaluated to see do you really still need it. And if you're not getting better, maybe therapy is not effective.
Okay, what I should probably do then? Well, my doctor, he checks me like every 2 years, with the back, where they check you for your allergies, and he said they're still pretty bad. So, you think I should talk to my doctor about it?
Yeah, I mean, different people have different training and different philosophies. Okay, it's like anything else. If you have bad allergies and 10 years you're still having bad allergies, that is a very minuscule of the people. Okay? If you have a problem and we are working on it, it should get fixed for you. So I think if you have all those testing results and stuff, bring them on, and then I can take a look. And different people have different kind of training and different kind of exposure and different kind of philosophies, like anything else. So it's very difficult to say, but 10 years is fairly long time. Fair to say you've suffered a lot.
Okay. Thank you very much, doctor. I appreciate your help.
Sure thing.
Thanks, Dave. All right. Good question. I have another question here that's been submitted. We know about sneezing and hives as symptoms of allergies. Are there any other symptoms that are less known that we should know about?
Absolutely. Sinuses. You have sinus problems, sinus headache, sinus congestion, a lot of postnasal drift, feeling nausea, not sleeping well at night time. These all are coming from nose and sinus area. So this will affect people. People have a lot of migraines. A lot of time you see people with migraine. I actually have a patient I was talking, they have a herpes infection of the eye, which is not getting better for years, because allergy is also into the eye, so one thing fuels the other. So anything with the sinus, many ear infection, difficulty breathing or asthma, skin rashes or itching, very common presentation for it.
I noticed one of my bad symptoms, and I get it here on the show as well, and it's dusty in here, but it's my eyes water.
Yep, because things are getting into eyes, and that's the body's way of getting rid of something it doesn't like. You eat bad food, you want to flush it out, and you're running to the bathroom all the time because the body is trying to get rid. If something bad in your nose, you have a lot of discharge, it's
right
in the eye, it tears to get rid of it.
Okay.
That way.
Okay.
Yeah.
Immune deficiency again now.
Yeah.
What does one do if they think they have this problem?
Yeah, I think this is the main area we got digressed out for today. What I wanted folks to remember is it's very common. If there are people out there who catch everything which goes around them, if somebody has fever and they're going to get worse, somebody sneezes and coughs and turns into bronchitis, somebody getting fever all the time, somebody's gland swelling up, their level of energy tiredness goes down, they're getting antibiotic all the time, they may have immune deficiency. Very common, 1 in 500. If city of Conneaut has 20,000 people or 30,000 people, there are at least 1 in 500, 100 to 200 people with solid immune deficiency. So very easy, if you have it, don't, if you're getting 2-3 antibiotics to get rid of the infection, sinus not going better, bronchitis not getting better, ear infection not getting better, then I think, it's very simple. I take a good intake, very careful. History is important. Examine the patient. A lot of people don't have tonsils or lymph glands.
Right.
If they don't have that, that is a deficiency in the body showing that way. And then you do a blood test, you find it out, and then we can give them an infusion to boost their immune system, or we can give additional injections to help them. And they can have fairly good quality life. So people who are sick of getting sick all the time are the one, if you're listening out, they definitely want to make their ways to ACMC Allergy Clinic. We will definitely do it. I have already 4 patients getting infusion in the clinic. And winter is the time when they'll have it.
Now you mentioned to diagnose this, then blood tests, and then to find out if you got allergies. That's the skin thing, right?
We're talking of 2 different things. Blood test is for the immune deficiency.
Okay.
Skin test is for the allergy.
Okay, gotcha.
And I take care of both. My branch is allergy and immunology.
Gotcha.
So skin testing is the standard for the finding cat, dog, pollen, mold, dust allergy, food allergy, drug allergy. But immune system blood work helps me decide if your army or navy and light police is not working good to keep you healthy in the body.
Gotcha.
Okay.
Now David mentioned something about whether the doctor was taking regarding his allergies, was taking samples from his back. Is that where you?
No, what he is referring is that the doctor is likely doing testing on his back. And as I said, in my practice, if I do the testing in the beginning, and if the patient is not getting better, then I check again to see should I make it much more stronger treatment, or I'll do testing at 5-6 years to decide if he's cured and stop the injections.
Okay. Are there any options for treatment?
For immune problems, people who are sick all the time, sinus, bronchitis, likewise, very good options. 50% of those patients can get better with giving additional booster immunizations, monitoring and making sure their blood is getting stronger. A lot of these people have coexisting allergies in nose and sinus and lungs. I can fix them at the same time. And if we cannot fix with either or both of these, then there are this infusion called gamma globulin infusion, which is the protein which fights all these bacteria. So if I have the patient coming in the hospital, we get IVXs in them, they come once a month, stay in for 3 or 4 hours, we infuse them, and they stay healthy that way. But they need the treatment every 3, 4, 5, 6 weeks based on case-to-case basis. So very good option.
So you can do all this at...
Yeah, they don't have to go anywhere. This is, before coming here, I was teaching faculty in big institutions downtown Cleveland. So I have very big practice of immune deficiency. I bring it all here, and my goal is to create a zone of excellence around Ashtabula, Conneaut area for 50-mile radius. Nobody should go anywhere. We should take it all here. people don't to travel far, and it's very treatable, and it's very under-recognized. Very
Yeah, really.
Yep, it really is.
How long have you been doing this?
I've been doing it since 2000 since 2000.
Really?
Yep.
14 years.
14 years. Yep.
Going on 15.
Yeah, I was in Philly, then I went to, then I came here in Cleveland.
Mhm.
So I was in the Rainbow Hospital, I ran the department there, and then I went to Metro Hospital, ran the department, and then I came here.
Do you have allergies yourself?
I actually do.
Do you really?
Yeah, I get injections in myself. So
Yeah.
I do have allergies. Allergies is very common.
Yeah.
So
Yeah.
I actually have it.
Let's take this call, Doc.
Yeah.
Hi, you're on the air.
Morning, Patty. I wanted to ask the doctor, I know years ago they used to give the vitamin B12 shot for deficiency. Do they still do that? I'll hang up and listen. Thank you.
Okay.
Yeah, vitamin D is a vitamin, and that is not your defense system. The vitamin B does many things inside the body, but there's no direct link of vitamin B causing your problem of getting sick. So vitamin B is a vitamin deficiency which you can cause kinds of anemia with it and other problem, but that is not direct immune deficiency problem.
Okay.
Like diabetes, that is not immune deficiency problem. Thyroid problem, they're immune system problem, but they're not. Diabetes helps you control sugar. Vitamin B helps you regulate different things in the body, but immune system keeps you healthy from not getting sick. So if you're getting sick, meaning infections, viruses, fungus, bacterial, pneumonia, meningitis, kidney infections, sinusitis, bronchitis, skin abscesses, that is what I can fix to a big extent for these folks.
Okay. Okay. Now I have a number here.
Yeah.
This is apparently your office.
Yeah, this is the central scheduling number.
994-7666.
Yeah.
And you know, if you do have a problem with allergies, this is the man to go to. He can help you out. Like you said, it's highly treatable. And to me, this is where I should be going because you get tired. I sneezed on the air this morning. I couldn't help it. You know, it's just, and that's not good. That's not what you're supposed to do. But yeah, this is the place to go. 994-7666. I can't believe we've done 35 straight minutes without a break, and you were fantastic. I learned more today than I've ever learned about this situation. I think it's like you say, it's not really discussed a lot. People just think that
People
they
don't
can
know.
live with it. You know?
People don't know, and you're right. They assume this is. And other, I'll close with this: that a lot of seniors. I really feel very strongly for seniors. Everything gets written down that you're getting old, the body is falling apart.
Yeah, yeah.
And I have a patient. In my last job at Metro, I had a 94-year-old woman who was on these infusions, and she's done very well with that.
Really?
Yeah. So seniors, anybody with chest problem, they may have COPD with smoking, they can have allergies, asthma attack, we can help them all. So seniors, really, if they're listening, I think they want to come out, and I can help. The lung is the alma mater of all the problems in genesis. You get bronchitis, pneumonia, and that's how you go downhill. We can fix that problem very, very, very well.
Another question, Doc.
Yeah.
Is there a relationship between allergies and immunology and obesity?
Obesity, there's no direct study done for obesity and immune dysfunction.
Okay.
So it's difficult to answer that question, but obesity has direct link with asthma and difficulty breathing or chest issues.
Okay.
So obesity is seen, people with obese does have more lung problems. That is well established. A lot of those people have sleeping and snoring problems, and that can the allergies can deteriorate and worsen it. Immune deficiency per se and weight, that will be good study to do, but you have to take a lot of blood on a lot of people, and somebody has to foot the bill. So there's no direct link thus far on it.
Another question. When someone has a food allergy, that food is sometimes in a family of foods. Can you give an example of that? If you are allergic to one food, what another food would be that you should avoid?
Yeah.
Or if you're allergic to, say, aspirin, are these foods or other things you should avoid?
Yeah.
Like Pepto-Bismol and that sort of stuff there.
Yeah,
Aspirin.
so the food, like anything else, they belong to different families based on their species and the proteins they carry. So nuts, like peanut although it's called nut, it's actually a legume. So people who are allergic to peanut have problem with the soy quite frequently.
Mm-hmm.
Peanut is also close related to all the nuts, almonds, pistachios, cashews. So you should avoid all those things.
Okay.
Fish. If you're allergic to one fish, very common to see majority of those patients will have allergic to other fish. So seafood sticks together.
Mm-hmm.
If you're allergic to one shellfish, crab, you may be allergic to shrimp and lobster as well.
I'm highly allergic to mussels.
Yeah, we spoke well, last time I came.
Yeah.
So that belongs to shellfish.
Yes.
And you may one day find yourself having problem with crab and shrimp and lobster too.
Yeah.
So a lot of these families go together. Milk. Milk comes from cow.
Mm-hmm.
10% of people who are allergic to milk are allergic to beef, because beef is mother of milk. That's how the milk comes about.
No kidding.
So when you think of allergy, you think about if you're allergic to parents, you're allergic to their kids. If you're allergic to the trees, the apple comes from the tree. That is son or daughter of the tree. So you're allergic to the pollen, you're allergic to that. Latex. If you're allergic to latex, banana, chestnut, avocado, kiwi, they have some common protein which looks like, because your body don't know what you eat. What you know what you're eating is what your eyes and brain think.
Yes.
But body knows is, body is not eating apple. What is body eating is after chewing and degrading it down, what gets into your stomach and what gets in your blood, eventually it's a very small amino acid and protein or carbohydrate in it. And that is what body sees. And the immune system picks the protein part of it, and that's how it says, oh, I have this protein. Now if that protein looked in latex, for instance, if you ate banana, and banana protein looks like latex, your body don't know you're allergic to latex or banana, it's the same thing, it fires at you. So we think what we're eating, but that's good for us to see, but what is absorbed in the immune system is very micromolecule, and that is how you react on things.
You know, you mentioned peanuts, and I see that now they're really watching it, especially with youngsters in school and stuff, not allowed to eat peanuts.
Right.
I never heard of that before.
Yeah, because again, it is Pat, as we become more clean, the body has nothing else to do. I always give lecture and tell, if you have a teenager and you don't keep them focused and busy, they go to drugs and this and that. If you keep them focused and busy, they become very productive professionals. If immune system is developed to take care of infections, if everything is clean, there's no pathogen, table is clean, chair is clean, food is clean, hand is clean, mouth is clean, everything is good, your body is, what does it do, immune system? So then it comes out and starts fighting these things, allergies you're exposed to. So in the developed countries where hygiene is very good, allergies are going high. I come from India, allergies are here. Infections are there because it's the hygiene, public sewage system, cleanliness. So this is a price to pay for the cleanliness. You trade hands. You save, you protect yourself from infection, but then you suffer from autoimmune disease and allergy. So that's what is going on.
Wow, I learned so much today, Doc. It was excellent.
Sure, I'm happy to come back again and we talk.
We're going to re-show this probably the first of next week, because for those that might have missed it, you don't want to, because you can learn a lot from this. Get your stuff taken care of. Don't live with it. Just don't think it's, you don't have to. You got somebody like this in this county that can help you take advantage of it.